Good morning, everyone. My name is Sarita Kohli, and I'm the Interim CEO of ACA. And I just want to welcome everyone here today. We're very pleased to be able to host this with Community Health Partnership. I want to say that Dolores pointed out all these people from the health system. VMC Foundation CEO Chris Wilder is here, and from Santa Clara Family Health Plan, Indian Health Center, Gardner, all of this. And these are all healthcare facilities. But one of the biggest benefits to me, I'm from the behavioral health world, was the expansion of mental health and substance abuse treatment services under the ACA, which impacts so many of the families that we serve. And compounded with the low-income population that we serve, that just creates a downward spiral. So one of the huge benefits to me for the ACA was the behavioral health benefits and the mental health parity that came about, which has benefited low-income minorities dramatically. We here at ACA serve all of those people who will be adversely impacted if the ACA is repealed. Low-income folks, women, immigrants, refugees, LGBTQ folks, the elderly, and folks that are struggling with mental illness, and those that were previously uninsured but do have pre-existing conditions which got covered under the ACA. When I think about the LGBT population in particular, the ACA forbid healthcare providers who are taking funding from Health and Human Services from discriminating on the basis of sexual or gender orientation. It allowed same-sex families to apply for joint coverage. It also removed lifetime caps on care for chronic conditions like HIV, where the annual cost of treatment can be very, very high. These groups will continue to be vulnerable without the ACA or something like it, particularly because of its anti-discrimination provisions. The other marginalized group which has been targeted is women. ACA has helped to ensure quality and affordable care for millions of women. Approximately 9.5 million women who were previously uninsured have gained health coverage through the ACA. 55 million women now have access to vital preventive care at no cost. And some of these services are like annual well-woman exams, breastfeeding support, birth control, screening and counseling for domestic and intimate partner violence, screening and treatment for sexually transmitted infections. And these services provide critical holistic care for women who were previously struggling to meet these needs due to cost and lack of access. Many, many studies have shown that healthcare costs are a barrier for women seeking health services. If the ACA is repealed, women's insurance rates will increase because their health services are more expensive, and women could be denied health coverage due to pre-existing conditions. Loss of vital services such as free birth control, maternity care, and preventive services will hit women of color and low-income women the hardest, contributing to more health inequities and health disparities. Another population which is really impacted is elderly, the elderly in general and elderly immigrants in particular. In the 2010 census, about 12% of Americans over 65 claimed to have been foreign-born. And that number has only gone up because of refugee access and family reunification and other national immigration policies. Now, newly arrived older immigrants tend to have low incomes, and they have far less in savings than their non-immigrant counterparts, and they're far less likely than native-born residents to access even available social services. Cultural and linguistic isolation, which we see at ACA every day, adds to their vulnerability. And I will just end with saying something. I want to read, I heard this morning from a young immigrant person in their 20s who would not have been able to get medical coverage if it hadn't been for the ACA. And she is now fearful that they may no longer be able to afford that coverage if ACA is repealed. And she said, "I have been hearing concerns from my family members and members of the community where I attend church. Personally, I have a pre-existing health condition. I have a chronic illness, and I fear that with the repeal of the ACA, I may be turned away from receiving health insurance or might have to pay higher fees. Also, I worry that big pharma companies will not be regulated. and may increase their prices or be allowed to charge us their retail price. For my own health issue, I know that the retail price of refilling my medicine is over $1,000 a month. But luckily with the ACA, I haven't had to pay that from my own pocket. So, do what you can to advocate for not allowing ACA to be repealed. And welcome everyone. Thank you.